Welcome to Healthcare Quality and Risk Matters, the show where we dive into the topics that matter most in healthcare quality and risk management. Wondering about patient safety, quality improvement, or risk mitigation, but weren't sure who to ask or were afraid to ask? Well, you're in the right place. We create a safe and judgment-free space to explore these critical topics together that will leave you informed and inspired to make a positive impact on healthcare and patient outcomes. So let's learn and grow together because healthcare matters.
Well, welcome to Healthcare Quality and Risk Matters. My name is Gary Bierc. I'm the CEO of Aperitisoft Healthcare, and I'm joined with my esteemed colleague, Rob Santamoor, who is our Chief Operating Officer. And we're missing Dr. Timothy Brown today. Timothy has some personal matters to attend to. We wish Timothy well and safe travels while he's away from us. We are thinking about you, Timothy, and we'll try to inject our thoughts as you would to best represent you today. We got a special show for everyone today, and we want to welcome you for joining us. We're going to do a little review over the course of the year and play some clips from different shows and revisit our thoughts around those things as we kind of reminisce on some of the great stuff we talked about over the course of the year today. And while we're getting started, everyone, please go ahead and put a little comment into your comment section. Let us know where you're from. We'll be able to give you a shout out as we're going through the show today. And all throughout, please throw us your questions, your comments. We'd love to hear them as we're having our discussion throughout this episode. So, Rob, I think we're going to start by going back to my favorite, which is
I don't have this. I love the segment. It was not my favorite experience, but yeah.
Which is the audit nightmare. This was our podcast back in June. It was entitled "Are You Stuck with Disparate Systems?" And why don't we roll the tape? Then we can talk about it a little bit.
Sounds great. So when I turned over the packet that they requested, the look of frustration, disappointment, and confusion by the auditors was definitely a low point in my career. I will add, I was new to this hospital. And I was not in charge of those processes. My level of embarrassment was extreme. My face was red, and I just knew from a quality perspective we had failed. At that point, the auditors looked at that. They decided they're not touching it. They're going to go home for the day, and they're going to come back the next day. They ended up being there for 3 more days, when realistically it should have been a day. By the end of the audit, I had made 71 additional phone calls. I had tracked 14,000 steps for just the audit activity, and I had worked across 5 platforms to try to prove that we did the right things for the right reasons. We were not able to prove that. We were not able to prove adequate corrective actions. We were not able to prove implementation of processes as outlined by our standard operating procedures. And all because our poor documentation was able to find these floating disparate things in cyberspace and on people's desks and Post-its.
How much did this cost?
So it led to multiple conditional level findings, significant financial penalties with extensive corrective action needs. The penalties associated with the cost of poor quality, it was over $4 million.
Oh, my word.
Wow. Okay.
Okay. $4 million. It's amazing, Rob, and correct me if I'm wrong, but this hospital really were doing all the right things, but they didn't document anything.
That was the worst part. I knew by the staff interviews, everybody was so genuine. Everybody absolutely cared about what happened. And everybody had awesome answers. They were extremely articulate regarding the event that they were there for, the original event. I couldn't prove it. That is horrifying. As the quality guy, my job is 3 things: protect the patient, protect the organization, and protect the providers. And I wasn't able to do any of those things because I had no documentation to do so.
This is a classic thing, though, right? I mean, from what I've been learning from you, working together over these couple of years, um, that hospitals have it in their heart to do the right things, but if they don't document, they lose the fight, because if somebody can document their claim and you don't have documentation to prove them wrong, you lose.
Every time. Whoever has the best documentation is always going to win. They're able to prove their case.
And this is where disparate systems are just, I mean, I get it. People walked into these different systems because they had an immediate need, but they never really looked at the holistic issue of how to manage quality. And I'm very proud, I know you are, that we have a product that does that, that allows for somebody to integrate all these different items. I know you had mentioned before, if that hospital had Aperitisoft Healthcare, the auditor would have been in and out in 5 minutes.
Yeah. It would have been very easy to turn over a packet that I either printed or brought up on the screen and said, here's what happened, here's what we did about it, and here's what we're continuing to do so that those things don't happen again. And that should be essentially export to Word, print to PDF, export to Excel, or just let me show you in real time.
Yeah.
It should be that easy. And it's very disheartening when I have these people that are getting in trouble, right? And potentially their licenses are on the line, all because I can't put the story together. And you can't speak to it, right? You can to an extent. They're willing to interview, but you can't just speak to it and think that that is going to be enough to explain what happened a year ago, 3 months ago, or even last week.
And this is not minor, because the way that our legal system works, not only are these nurses, for instance, could lose their jobs because of this problem, they could lose their license, but even worse, they could lose their freedom.
They can.
And end up in jail, which leads us to the next thing. We were talking about this, that nurses need to speak up. They, that is a truth about their situation. And you made a great comment about being loud, and it's a great tape or an example of this situation. Why don't we roll that tape? This was done back in May of 2024, and I think we can title it "Nurses Quality Has Your Back." So why don't you run that one, Rob?
Sure.
How can nurses advocate and maybe contribute to that culture of safety for that nurse that's like, maybe I'm new in the organization, I don't really feel that I can make any type of contributions? They can, but from your perspective, how can they make that conversation that's needed, or have that conversation that's needed to improve the overall culture of safety for their organization?
Be loud. So we saw it during COVID. Nurses have the ability to be loud, and nurses have a lot of leverage. Nurses are truly the backbone. And I don't mean to speak for myself, but I am a nurse and I know the work that they have to do. Nurses are the backbone of healthcare. What better structure there's to force change than the backbone? So be loud. Tell your administrators that you want there's good quality in your organization. You can work anywhere as a nurse. Tomorrow you can have a brand new job. There is a massive need. Tell your supervisors, tell your managers, tell your administration, you want a system of quality. You want something that's going to protect your patients. You require something that is going to protect yourself, because there's no reason for you to go to jail because the other side's documentation is better than yours because your hospital failed you. Be loud, tell them what you need, and it's a need. You need to protect yourself and your patients, and advocate for strong quality programming.
Amen, brother. Let me ask you, Rob. I mean, if somebody's being loud, okay, and they're tired of being at the receiving end and now start speaking up, and are their jobs that quickly at risk in this environment? I don't think they are. I think they've got a lot of leverage right now, nurses, because they're understaffed.
It is near, how do I say this? It is near impossible to fire a nurse right now unless there is something negligent against a patient. That's not, of course, universal. My hospital leadership colleagues often express frustrations to me over especially the last couple of years on their inability to have favorable turnover where they need to term somebody that's maybe toxic or underperforming, and they're not able to let them go there because they need the licensed person to provide care. I think nurses have an amazing amount of leverage right now. I will say there needs to be multiple voices.
Right. Organize.
Collaborate with your colleagues.
Yeah.
Speak as a group during your morning huddles, during your afternoon meetings.
And not in anger, but professionally lay out the pain and the concern. Let management know that this is a problem. Because if they don't speak up, I don't think anything's going to happen to change. And I don't think they should be risking their licenses and especially their freedom over a fear that management's going to be angry and fire you. I just don't think that is worth it.
In the nurses, the doctors, there's the advanced providers, they rely on hospital systems to protect them. And I think that there's a perception that these things are automatic.
Yeah.
That Rob, the risk guy, is going to be able to come down and talk to the Department of Health, and really he's the one in trouble. So yes, I am the one in trouble. But ultimately, when it comes to there's the final corrective action or the final actions taken, especially for patient-focused things, it's the provider's license. I might be the one sitting in front of the Department of Health. I might be the one who has originally served the subpoena, but ultimately the impact is on that licensed person. And if I can't protect them because the hospital failed to provide adequate systems, that is an awful place for me to be, and even worse for the people who have their license or freedom in jeopardy.
Yeah. We've talked about culture as being a big part of this, right? That culture is disseminated from the top down.
Yes.
And leadership needs to take a stance and understand that quality and safety and revenue and costs, they're all related. They're all connected to one another. And for them to have a safe, comfortable work environment for the nursing staff and the medical staff, that they need to set that tone. That what do you need? What do you need to do the best job for our patients? What do you need? How can we work better going forward? And we had talked about, and we'll get to that clip next, that the culture problem is pretty severe, where when they think of budgeting for bad things happening, they don't think about that I should be budgeting for trying to improve quality, not just go ahead and just put money aside because bad things are going to happen. And then the culture it's more about reacting than to making change. So why don't we roll this next tape? Let's call this Budget for Quality is the name of the clip. But this was when we were talking about building an HRO organization, and this was back in August.
I like that one. All of it is insane, right? We're budgeting for poor quality instead of budgeting for quality. Doesn't make sense. But there's the most baffling.
Say that again, because that should resonate in our listeners' ears. That this budget line that's happening in the hospital's financials is budgeting for poor quality.
Yep.
Not for improving quality.
Well, and the argument is we're in a human-driven world, right? Humans
Mm.
again, to err is to human. And instead of ensuring we have processes in place and a culture in place, there's in this driving force of quality and risk. There's within the organization that prevents these things from happening, and then when they do happen, prevents them from happening again. And thing, right? But this argument with there's CEO, was around, well, they didn't budget for there's the poor quality, but they do find the money other places. They reallocate the money when they have to pay the fines. So you do have the money.
You have it, absolutely.
You just do not prioritize it because it's not your culture to do so. So culture drives everything. Leadership decisions drive everything, and it starts at the top.
Agreed.
Yeah. Why don't you say that again?
And it does start at the top. It absolutely starts at the top. When you have a group of nurses and doctors, or physical therapists, respiratory therapists, EVS staff, doesn't matter what your role in the hospital is, you should feel like you can express concerns, you can identify risks, you can suggest quality improvements, and you can be a part of a system of quality. When you're scared to go to your leader, because if I bring something up, Gary's going to be mad, and like that doesn't work.
Yeah.
That creates an awful organization. Your organization will never improve. You are never going to reduce risk. You are not going to be compliant. You are going to have high turnover, low quality, poor patient outcomes. I mean, we can just keep going down that line, right?
Yeah.
All of the downstream effects of poor leadership, because honestly, that's what it is. When you do not create an organization where people feel empowered to share their thoughts around quality, risk, and compliance, that is because of poor leadership. And you have not established there's a culture of quality.
And what's amazing is that, we've talked about some of the numbers and they're astronomical. I mean, depending on the size of the hospital, I mean, we're talking $15 to $40 million is being budgeted for poor quality.
Easy.
And I've said it in another episode, the complaint is that we don't have the money. We don't have the money for that. We need it for something else. Well, the funding that you need to drive improvement in your hospital is right in that line item. All it takes is an investment in a proper quality system, including software, that's going to drive change. And you make that investment, you're freeing up funds. You're freeing up the capital to do new and innovative things in the healthcare industry. Why management doesn't see that connection, I don't know. But it's a big one.
Yeah, I mean, that's been a huge frustration for me for years. I can't wrap my head around where the logic comes from. And I believe in a later clip, we dig into that a little bit when we get into cost of poor quality. But when our executives have a clear pattern of poor performance because of the culture they create, the hospital's just never going to be successful.
Yeah. It's almost like they get themselves into a down spiral.
Yep.
And I think, if we want, we can go to there now, but we were talking about hospital deserts.
Yeah,
and
that's true.
And the fact that, and this is looking at our episode on the cost of poor quality back in October, but we're talking about hospitals are starting to get shut down. They get caught in this down spiral vortex and they can't get out. And, I know we can help them. If you're a hospital and you're starting into that spiral, there is a way out. Please reach out to us. We'd love to help you, but don't get to the point where you're shutting your doors. That doesn't serve the community.
No.
And, that's what we need right now. We need quality healthcare available in every community. And we should never allow it to go to this. Why don't you run that tape, Rob?
Yeah, I'd be happy to run that one.
trying to wrap my head around the fact that quality is the defense against these bleeding costs.
Mm-hmm.
And if hospitals are not deploying the right things they need to, not only is inflation hitting them hard and the lack of staff to meet the need, now they're bleeding out the side of the ship, so to speak, and they can't stay afloat. I mean, how are we going to grow and improve as a healthcare system in the United States or around the world, for that matter, if we're not hitting on all pistons? And one of those pistons has to be quality.
Absolutely.
And Gary, to that point that you just mentioned, with healthcare organizations not being able to keep up, we're starting to see healthcare systems close at a rapid pace, unfortunately, which
And
means
that's
that
frightening,
patients,
Timothy. That's frightening.
Patients are now having to go further to get the medical care that they need. And it's really sad for these communities that have their hospitals that are shutting down. I mean, it's worse to see, of course, a food desert, but then you think about a healthcare desert on top of that, it can really be devastating for someone that needs quality care within reach.
Wow. And it's real. I mean, I think recently, Rob, you shared with me another hospital that closed their doors, and it's very, very sad. And we have ways to determine if you're on that down spiral. If you're listening today and you're a leapfrog C rating and you're struggling to get into B and A, you're in danger. If you're was it the DNS?
2-1, yeah.
Yeah. If you're not up to a 5-star rating, then you're struggling, right? I mean, you're at what is it, 3, 2, 1? These are red flags, and you might say, "Oh, well, all they need is documentation." Well, that's a symptom. That's a symptom that you may be in the down spiral already.
I agree, and I hear that too. It's just the documentation, and I hear blame for the clinical staff. I hear, well, the root cause of this is being short-staffed. That is a contributing factor, right? There's short-staffed. It's harder for people to have time to document. It's harder for people it's harder to have resources to allocate for improvement. I get that those are challenges, but the root cause is not that you can't get your nurse to do something. It's not that your quality guy didn't make sure that you met that standard. It is back to the top down, right? It's the culture, it's the accountability, it is the systems, right? What do you have in place to close the gaps that are inherent with people-driven processes? How do you eliminate those gaps? How do you identify them? How do you continuously improve? What is your line of sight in quality? If you don't have that, then you're never going to reach, to our last clip, there's that HRO status. You're never going to be on a consistent upward trend. With either your quality, or frankly, your operating margin.
And it's interesting where symptoms are often called causes, where they're more consequences. When you're low on staff, that's not your cause. That's a symptom that's a consequence of something. Top hospitals, they may not be staffed to the full degree they'd like, but they're not fully understaffed. They're sufficiently staffed. Why? Because nurses and doctors want to work in good environments.
Mm-hmm.
And these good environments include that they have the proper systems of quality in place where they feel they know their back is covered.
Yep.
And they can then focus on doing a good job.
I fully agree that your top hospitals are fully staffed. You have people who are sometimes clawing at the door to get in. They want to work there.
Yeah.
And I'm not saying it's easy for them. I know that there is a shortage of people to provide care, but it is significantly easier for them to provide, at a minimum, adequate staffing. There's maybe not where they would want to be, to your point, but adequate staffing. But then you get those Leapfrog F, CMS1, there's hospitals that are consistently under conditional level findings, and nobody wants to work there.
Yeah.
They can't staff, and they end up closing down. And unfortunately, patients don't have great outcomes at those hospitals.
Well, I did a little straw man poll when I was getting my hip replaced last year, or earlier this year, and I was amazed.
Always assessing, Gary. Always assessing.
Yeah, always. I'm sorry. It's a default in my wiring, but but I asked maybe 5 nurses. When something bad happens around here, how long does it take for you to get an incident reported? And they would say 15, 20 minutes to get the thing reported. I said, well, when do you do it? Right away? Well, no, I don't have time for that. It's always at the end of my shift. And I said, well, wink, wink. I said, you ever have a situation where you never could get it done? And they say, absolutely. Absolutely. So, with the Aperitisoft Healthcare, we've got that down to 2 minutes. So if you're in a situation, as a hospital and you're in the down spiral and you're starting the down spiral, but you're trying to do the right thing. You want to get a quality system in place to start improving things so that people are enjoying working at your hospital. And now, you're going to be able to get out of the understaffing issue. It begins by giving them the tools they need to get things reported so you can take corrective action.
Yeah.
It's not complicated. It really
not.
And that's, yeah.
We know universally, the more you ask of somebody on a particular task, the lower the compliance is on completing that task.
Yeah.
There's the idea would be for efficiency. The idea there's ultimately in this case is to keep your providers, your clinicians, there's your staff in general at bedside and keeping the hospital running.
Yeah.
We spend already a lot, and as a quality guy, I'm going to say this out loud, we spend way too much time documenting. There's when we need to be spending way more time at bedside.
Yeah. And let the quality team investigate. Quickly get it into their hands. Let them do the investigation. You do your job.
Exactly.
Right? And it's amazing that nurses are expected to do a little bit of quality's job by putting in the right codes, putting in all the right descriptors that they need to be able to even react.
They have to be adjusted on the back end anyway because they don't apply.
Right.
And it's out of scope what we're asking them to do.
These systems weren't designed for healthcare. That's the problem.
No, they're designed for
and that's where Aperity Healthcare is different, right? Aperitisoft Healthcare is designed for healthcare, and it's designed to do this, which is going into that whole issue. What we're talking about is proactive, right? Take steps proactive to get yourself out of the spiral and start making change versus always reacting. If you're always reacting, it's just going to continue until eventually your doors are closed. I think the next tape we kind of touch on that a little bit. Why don't we run that one?
I always say in an organization, when you do a surprise audit, there really should be no surprises. And oftentimes there are no surprises. It's just that either you have employees that don't feel that the culture is strong enough for them to be able to speak up, or there's no mean or process for them to be able to provide it. So we went through a major pandemic a few years ago. We're still coming out on the end of it for healthcare. However, there's so many different things that we should have learned, but I don't think we have learned from a healthcare standpoint. And being proactive. How do we prepare for what's coming? How do we prepare for how to move forward in healthcare? And I think that is taking that more proactive approach and standing away from trying to put out every fire and really assessing the overall ground and land and finding a way for us to identify what areas are our biggest risks, what areas could potentially use additional resources beyond that. So it really comes from having that, like we said earlier, that system, whether it's an artificial intelligence system, whether it's a computer system, or having the processes in place for your organization to thrive and move forward. And it definitely starts with number one, having communication and having the right people at the table.
I don't know if you can add anything to that.
I don't think that you can. That I think sums up a lot of what we were saying. Making sure that the top there's tier of the organization leadership wise there's believes in quality, they believe in good patient care, they believe in good outcomes, they believe in good business. And that includes making sure that you're developing your organization under quality principles, under risk reduction principles, under there's evidence-based practice, there's for how you're going to achieve the best possible outcomes for your patients.
Yeah. Well, I mean, one of the things that quality people always say is that they don't have a seat at the table. They're
don't.
not, you know, and it's pretty much common in all risk management fields in every industry. You know, risk management is often relegated to a compliance exercise, keep me out of trouble exercise. Leadership struggle to understand how risk and quality are a value generator, and where they're extreme value generators. You know, you're getting insights into things, into decision making that you didn't have before if you would just listen.
Yes.
And it will guide the future of the organization. So strategic planning is a big part of that.
Yeah.
And so we've got another clip. It's another last word clip about strategic planning. And this was our September episode where we said a seat at the table is, you know, we were talking about that. So let's roll this tape. This will be our last tape, and then we'll see if we have any questions, and we'll wrap it up with that.
Perfect.
You know what you just said about the doctors that focus on, well, I'm doing everything right, I'm in my wheelhouse, and not what does quality have to do with me? And I want you to take it from the perspective of the doctors that were working at the hospital in Ohio. Doesn't matter if you're doing everything that you need to do in your wheelhouse, if you don't understand that if you're looking at the big grand scheme of things, if the hospital shuts down, what does that mean for you? That means you have no patients. That means you're out of a job as well. Then whatever you thought you were doing in your overall wheelhouse is no longer a wheelhouse. So there is a bigger picture when it comes down to quality. And I think that each individual department, each leader should take that into consideration when we say, well, I'm just going to stick to my wheelhouse and only do what's right in my overall wheelhouse. You are connected to this bigger web. Think of it like a spider web. You hit one side of a spider web, the entire web's going to shake. And I think for this overall hospital in Ohio, the web just broke. And it affected all departments because the entire organization was shut down, unfortunately.
The web just broke.
Right. I love that. And again,
great line.
There's Timothy just summing it all up for us. It's perfect.
Yeah.
And I mean, what? Don't let your web break. It doesn't seem that hard. And I know this is what we do full time. So for us, it feels easy and logical. And I realize it's a mindset change for a lot of our hospital leaders. But if our hospital leaders can't see what's going on in healthcare across our country and acknowledge that it's broken and think that they don't need to start changing, then they should not be in leadership.
Yeah. So, Rob, do we have any comments or questions throughout the episode?
There's some shout outs, and I thank all of those that have joined us, letting us know where you are. There's there's Darnell and Martin. Thank you for joining. There's everybody else that joined. Thank you. We appreciate the sentiment and the attendance, and encourage everyone to drop in future comments. We have a lot of listeners that listen offline. They end up listening to it later. And we love the comments. We love the emails. We love the questions. We love the phone calls.
Absolutely.
Happy to engage. There's happy to provide any support. Please reach out. Please keep the comments and questions coming, and we will respond to all of them on LinkedIn, on email, or by phone.
And we are just so thankful for your support this year. I think healthcare quality and risk matters has been growing throughout the year, and we are very thankful for that. And as we look into next year, we want to cover topics you want to talk about. So we are going to ask you to go on LinkedIn, send us a message or comment on this. Throw us some topics that you'd like us to talk about for next year, and we'll get them into the docket. Reach out. There's a new website we have there, insights at aperisofthc.com. Just click on that and send us all your thoughts, and we can respond right away. Also, please like this episode and any other episodes that you have watched in the past. Please go ahead and put a like on that. That really helps us. And share it with your friends, your colleagues. That it's important to connect with us. We're trying to serve the community, but we need your feedback to do that well. So again, thank you for everything you've done this year, everybody, and we're looking forward to the new year. When is the next episode, Rob? January
the
what?
next episode is the 4th January, or 4th January. That's the 4th January. It's the
fourth week in January.
Wednesday in January, which would be the 22nd.
The 22nd of January. And we'll look forward to you guys joining us then as well. In the meantime, have a wonderful holiday season, everyone. We wish you the best and a prosperous 2025. And we just want to thank you for listening. And we'll see you next time.
Thank you.
Bye-bye.